So, how does this need to get out? I think there are a few places it needs to get out to the public. The CAHPS is possibly a very good measure of what the nursing care is at a hospital. Patients don't quite know that, although they kind of do. They probably know that patients are satisfied, the hospital is pretty good, but do they understand that that relates to the nursing care as much as it does? Number two, nurses. I did sort of a little pilot on my own. I couldn't find one nurse who knew more than one question that was asked on the HCAHPS about nursing. I don't think nurses understand what patients are being asked and how they're being evaluated on their care. I think there needs to be some work done in that area. Administration, in terms of increasing RN staffing, may improve hospital ratings. Jack Needleman did some work on this and what the costs are, and he felt that increasing the RN richness would actually be cost savings. Increasing extra RN total hour or total nursing hours would be a slight cost, but cost is not a big issue with this, but administration should definitely understand that RN staffing makes a difference in the bottom line rating of their hospital. Policymakers, increased RN staffing associated with improved ratings, patient safety issues such as medication information, danger signs after discharge. So how do you reach these audiences? These are some things we were talking about the other day. I think some of them reaching the public can be done by what Adams is going to show you right next, which is a publicly available website. We could do some information on that saying that the HCAHPS is very strong representation of nursing care in the hospital. We could also possibly get some other information through Burness or in the media out to patients about how important that is to look at the CAHPS survey. To nurses and administrators, we can do some online publications. There are huge amounts of online things going out to all nurses to help to encourage them to understand what they're being evaluated on. And policymakers, certainly some classic publications, we've been talking with medical care and some other journals that we may be able to do some sort of routine publications. And then there's Twitter, of course, and we're trying to sort of figure out how Twitter or YouTube or some sort of more social media might be helpful to disseminate some of this information. And then Adams wants to just hook up with the calhospitalcompare.org and say a few more words.
Could you please, I need Heather's assistance here. Could you please go to Google and Google California Hospital Quality? So I think we got funded for this study for a couple of reasons. One, I hope we had a good conceptual model about which, so people had done prior studies, for instance, comparing Joint Commission measures or assessing the relationship of RN hours to Joint Commission measures, but we didn't think all Joint Commission hours were equal, and so we focused in on the ones that we thought were going to have more nursing content. And same thing with the patient satisfaction. Yes. So actually, before you leave, anyway, can you go back? So as we have been developing evidence about the potential impact of nursing hours, and let me back up one step. We've heard over and over in the last couple of days, there's no business case for any of this. And so a big part of what we've been trying to do is, as we develop the evidence, also create the business case. So you Google California Hospital Quality, and the first thing that comes up that's not a sponsored link, so it's hard to tell on this screen, but that would be highlighted as a sponsored link. Someone paid to have their link above it. The next thing is calhospitalcompare.org. If you could click on that, please. That is the website that we've created through which we disseminate this kind of information. Could you type in San Francisco, please? So and don't accept the hospital, just stop at San Francisco. There you go. Just hit delete and not hit return. Oh, sorry, you're in the, switch to location tab. I'll tell you when to leave the screen. Switch to location and go to San Francisco. So what we're trying to do is fundamentally change this game. And as you can see, hit go, and then you'll have a legal thing. Okay, it's already been accepted at some point. So as you can see, these are the hospitals in San Francisco. Chinese Hospital is a little tiny Chinese language only hospital in Chinatown that has 120 admissions a year. All the other hospitals in San Francisco are participating in this project. It's voluntary, but we have signed up now 246 hospitals across California. Could you please click on CPMC St. Luke's? And now accept the legal disclaimer. And in this, through this website, we get so we created a task force with all the health plans and the hospital association and consumer groups and employers. And now everybody directs their beneficiaries, members, et cetera, to this. So if you're a member of HealthNet and you want to choose a hospital, you get directed to this website. We get 1.5 million page views per year. And you could see we rate things that have a lot of nursing component to it. It turns out in critical care there's not much variation in nursing input in California because we have mandated ratios there. But you see patient safety. If you keep going down, you'll see hospital-acquired pressure ulcers. This hospital is doing below average. Their patient experience rating is okay. Could you click on, go back up? Click on the other surgery tab. So this is where you would go if you were interested in elective surgery, and if you could go down now to the patient experience. So here, this hospital is rated below average. Now, San Francisco is not a big town. It's kind of square, 7 miles by 7 miles, and you saw there are about 17 hospitals. And there are hospitals that are above average and hospitals that are below average. And we actually have 5 levels. You can even get a superior designation if you're good enough. And then on top of that, there's an overlay now developing in California of hospital pay for performance. So basically what we've done as we develop measures is we discuss with, and we don't actually decide anything about what goes onto this website. That group that I mentioned, the health plans and the hospitals and the consumers, they vote. And we don't have a vote in their vote. We just do what they say. So we're the conveners, and then they decide. But we do get to talk to them about what to put up there. And so as you guys come up with more stuff, we'd love to hear about those things that you think are going to be important. Jeanette was developing pediatric nosocomial pediatric nosocomial infection measures, and finding there was a nursing content there, and those are actually the next thing to go up. They'll go up here sometime in the fall. We thought that the request here was to focus on dissemination, and that this is our dissemination plan. We talk to the stakeholders all the time. We try to get it publicly reported, and it is in all the pay-for-performance programs in California. This is the only data source for that California health plans use for their pay-for-performance programs.
Thank you.
Sure.